So my name's Liam Williams, and I'm the Director of Quality and System Performance at South Central and West. And we're a CSU, which is a strange bit of the NHS that leads on a range of business support services, but critically to being on this panel, we offer transformation support and services and insights at a local level, so with individual providers, but also at a national and a regional level. And talking about whole system recovery, we talk about it predominantly now in the context of COVID, but this is something I think we were already trying to work through pre-COVID when we were developing STPs. And what STPs did was really set the scene for collaborative working. And what we saw through COVID was a massive increase in the level of collaboration that was required at a system level to try and support the needs of the population. And there's huge amounts of learning that will come from that. Good learning of what we did well, but obviously also learning about what we could do differently. And our reflection would be that taking the time to do some of that learning at a local system level now is important to understand how you can build on the foundations that you've already built over the last 18 months, if not previously. I'm the clinical lead, and so unsurprisingly, I want to go to the evidence base in terms of thinking about this, and the literature is quite strong really on how we get to effective system recovery, effective system working, and falls into three domains. Firstly is being really clear about system leadership, system relationships, building trust, building confidence in each other. And if we can do that at the most senior levels, then it will imbue the kind of collaborative clinical leadership and support that we need through the whole pathway. So effective clinical leadership at the top of the tree, hopefully then will create the culture in which clinicians through the whole pathway be able to collaborate and work together. And I've been really struck actually in social media since the pandemic has subsided a little bit in the UK, and struck by the clinical debate that's going on between primary and secondary care doctors, and actually the role we all need to play in supporting them to work effectively together, and not to feel that their own organisation is feeling the brunt of their particular pressures. So system leadership is key. Focusing on quality is second. It's not new news. We all know that if we get quality right, if we focus on outcomes from the outset, we're going to get the most efficient, the most effective use of resources. That evidence base now goes back for quite some considerable period of time, but it's not always the easiest thing to hold front and centre at a system level. It's easier to hold quality at the front when you think about it from your organisation's perspective, but the give and take needed to deliver on quality at a whole pathway, patient population level for a system is something that requires a lot more thought and commitment, collaboration, and sometimes tensions. And when I look to quality at the moment, I think that the single area that we could really focus on is the digitalisation of clinical records, the accessibility of clinical records, and how do we use that technology to its full capacity, not just being able to view and read and understand the history, but think about what the data within it can do to help us with future assessment, with diagnostic, and with ongoing care and patient empowerment. And then the final area that I would focus in on is resourcing. There's a bit of an obvious area which we would all know in the context of resourcing, which is finances. Everybody would recognise the challenge that we're going to face on finances over the coming years. We would all recognise also the challenge that we're going to face in respect of workforce. The workforce has been through a considerable period of immense challenge over the last 18 months or so. And there's no real sense of where the let up is going to come for them, either in respect of ongoing care and treatment to people with COVID, but importantly also in terms of recovering the level of care that we need to now give to patients with delayed diagnosis or with ongoing treatment requirements. But beneath that, then, I think are three key areas of resourcing: the estate, the technology, and the data modelling. How do we make sure we're using our estate as effectively as we can at a system level, not just at an organisational level? How do we use technology to empower the use of that estate, to empower our clinicians, our patients, to access really effective care? We've seen a massive growth in remote access diagnostics, in point of care testing. How do we embed that into care pathways in a way that supports not only one pathway, one organisation, but actually supports the whole pathway and is committed to by all of the providers in the pathway, all of the clinicians, with data flows that are effective. And we've talked a lot about data over the course of the pandemic. I think from an NHS perspective, we've learned a huge amount about the power of data over the last couple of years. But I think we need to think much more in a more structured way around what our data modeling looks like, our data architecture looks like, and what our data literacy looks like at all levels. And if we do that with some consistency, then it means that we're all talking a common language, we have a common understanding, and the opportunity then to measure our success as a system in delivering for our populations will be greatly enhanced.